Hello, my name is Anurag Saraf, and I am affiliated with the Harvard Radiation Oncology program. On behalf of my co-authors, we are excited to present our work in progress presentation titled Using the Dosimetric Radiation Plan as a Teaching Tool for Early Trainees to Understand Radiation Toxicity. I have no disclosures to report. Radiation therapy has drastically advanced in the past several decades, leading to highly complex and personalized dosimetric treatment plans. Despite the advancement of radiation treatment planning, medical students and residents and fellows in medical or surgical oncology-related fields, such as medical oncology fellowship, urology, or neurosurgery residency, have limited exposure to radiation therapy management and the role of radiation oncology in cancer care. Education literature suggests adult learners comprehend new topics in the context of prior experience. For many medical students and oncology-affiliated trainees, prior experience with radiation have involved clinical care for acute and late-term side effects of radiation. Dosimetric radiation plans are an accessible visual representation of an individualized treatment and may be a novel method to educate trainees about radiation toxicity. We hypothesize that utilizing a radiation plan module may improve understanding of acute and late radiation toxicity and increase knowledge of radiation oncology decision-making in cancer care among medical students and oncology-affiliated early trainees. We designed a two-part educational module to review dosimetric radiation plans with early trainees. In Phase 1, a didactic component reviews the general principles of radiation biology and physics to educate trainees about the acute and late toxicity of radiation. This is followed by examples of radiation treatment plans for common disease sites. Each example plan will contain target volumes, organs at risk, contact guidelines, as well as high and intermediate isodose lines to visualize how radiation is distributed over patients' anatomy. In Part 2, trainees will actively learn from example case. In this post-operative prostate cancer example case, trainees will engage with overlaid target volumes and OARs, as well as isodose lines of high and intermediate radiation dose. They will then answer a few questions related to the potential acute and normal tissue toxicities anticipated with each plan. Trainees will independently assess an example case and predict toxicity over 10 to 15 minutes during the seminar. Pre- and post questionnaires will measure understanding role of radiation therapy and predicting radiation toxicity in common scenarios. We hope to compare predicting radiation toxicity to a control group of trainees without the education module. We hope to determine if there is an association between understanding radiation plan and dose distribution and ability to predict acute and late-term radiation toxicity among trainees. We will also investigate if understanding radiation plan leads to greater understanding regarding the use of radiation therapy in both definitive and adjuvant setting, and investigate if the dosimetric radiation plan is an effective teaching tool for early trainees on increasing knowledge about radiation oncologists' decision-making. Future directions for this project include expanding to other institutions, building an OTV-based curriculum for medical students, and implementing dosimetry and toxicity seminar for new technologies, including MR-Linac, adaptive planning techniques for professionals in medical oncology and surgery. Thank you for your attention.